hypoglycemic experiences are not uncommon, and they leave a big footprint. And all of us would understand this. If you think about serious hypoglycemia being defined as low to the point where the conscious ability to treat it is threatened or compromised. Now, people experience this as the essence of loss of control. And so it can be a very serious psychological impact for somebody. So in this context, the hypoglycemia management is about the fear management. So this video isn't around how to treat a low, but how to address the fear that can be associated with severe hypoglycemic experiences. When fear dominates, fear of hypoglycemia, in fact, for many people, is more than a stressful event. Stressful events come and go, we deal with them, we move on, but basically we just absorb them into the background. And if you had a really difficult day 6 months ago because you were late for work and you spilled coffee on yourself and you got into an argument with somebody and then you got criticized later in the day, you may have experienced it at that time as a very stressful day, but you have no idea that you even happened now. It's a faded memory. But many fear events are more like traumas. And traumas alter memory in which the fear dominates. Where were you on 9/11? If you've ever been in a horrific accident, you'll remember it for a long time. So we know that traumas affect the brain and how it organizes their memory. Therefore, fear of hypoglycemia is important to understand as a fear management issue before a glycemic management issue. So this is a treatment approach that we recommend to healthcare providers. So hopefully in your clinical visits, if you're experiencing fear of hypoglycemia, and we would encourage you to communicate this to your provider, this is the pathway that we would recommend, that there be a screening for the experience of, are you at risk of, or have you had the experience of a hypoglycemic event? We would then ask, or you could tell us about the fear of hypoglycemia. It's important then to really normalize that fear response, that hypoglycemia can be a crisis situation. So to have a fear reaction is extremely important to appreciate and then to work with. The next step would be to explore how you manage that fear. So for many people, they will allow their blood sugars to run high as a way of avoiding going low, and that would make perfect sense. Maybe not from a glucose outcome perspective, but from a fear outcome. And the important point that we're trying to make here is that the fear experience dominates. The next step is to do something that we call determine a safety margin, and I'll explain to you what that means in a moment. And then the method of helping people is actually called graduated behavioral exposure. So it's important to elaborate on graduated behavioral exposure. The first thing that we would do is really determine safety zone. What blood sugar range do you feel comfortable with right now? And many people report that that is actually higher than what's recommended. And it's important that we appreciate that it's the psychological safety that will dominate here. Once we get a sense of the psychologically safe range, then we go forward with that. Now, we don't focus on ideal blood sugar range. The provider should not make recommendations based on the ideal. They should make recommendations about how we can lower the psychologically safe range to meet the medically safe range. And this is done in a way that you work with your provider and that you determine which steps to take. So let's say you were happy with your sugars being between 10 and 14. Rather than get it down to 7 to 9, you might say, what if we went from 10 to 14 to, 9 to 13? Or what if we just lowered the 14 a bit? And until you get comfortable with that, you stay at what would be a graduated step. And then by moving stepwise, step following by step, then you have a plan that allows you to work together. And by increasing your testing and by reviewing hypoglycemic management, what we find is that this is a very useful way of encouraging a person to go from the psychologically safe zone, which is typically high, to the medically safe range, which will be in your best interest in the long run. Thank you.